to tell me a little bit more about veneers at FY Smile?
So veneers at FY Smile are just not veneers. Every case is unique. People come in requesting veneers and say, what veneers do you use? And that's not really an answer that I give immediately, because we choose the material according to the requirements of the patient, according to the individual teeth, the shape, the colour. Is it a case where there's an implant involved, there's a dark tooth underneath, there's broken down teeth? That will have different ceramic material, as opposed to a younger patient that is requiring a super aesthetic result, whether they're modelling or they require a particular smile that requires very detailed, subtle build-ups. We will use very different materials. And having an innate understanding of the materials allows you to choose the best material for that case. What I discuss with the patient is what is the final outcome that we want to achieve and why. From there, I will sort through the materials, because discussing materials with the patient is not really the key. It's discussing with the patient what's their desired outcome. At what level do we want to be able to get their smile to? What is your appetite? Because you can have a beautiful smile just from straightening your teeth and whitening. But if you want to go next level, and this is according to what the patient's requirements are, then we'll require different treatment modalities. And then we'll need to look at the different materials, the different ceramic materials available.
Do you make your own ceramics?
Everything that we have is not made in-house. It's all with master ceramicists that specialize in each of the materials. So we have different ceramicists for different materials. Say, for instance, feldspathic, which is like a glass ceramic, has a very unique process, and it needs a unique type of technician or ceramicist that only deals with this and is able to relay the design that you give to this final outcome. Then there's special ceramicists that are very good with combination of implant ceramics and crown ceramics. So there's specialties within specialties and understanding. And I guess after years of doing this, we see who is the best for each of these cases. So no, we just don't have one ceramicist. We have many labs that cater for whatever the case requires.
Do you only do porcelain?
Most veneers are porcelain, but they could be a combination of porcelain and other materials. So they could be a layer of porcelain or zirconia, depending if you're trying to cover really dark teeth. So the underlying covering is porcelain, but it could have the different materials underneath from different types of ceramics, zirconia, Emax, which is a disilicate, sometimes totally porcelain, which is the glass ceramics. But again, each case is unique and different, and the requirements are different.
Is it just about a smile?
No, the smile is one component, but we're also looking at function and longevity. We not only design a smile that looks great and it suits the face, but we have to be able to verify that this smile will last in the mouth. If they're a heavy grinder or they've worn their bottom teeth, we need to assess. We need to build up that lower bite sometimes to be able to provide space. You can't just put veneers in a situation that's already worn down without those considerations. So there's an aesthetic aspect to veneers and there's a functional aspect. And marrying both is the key, and that takes a lot of discipline and planning. What the patient sees is the aesthetic outcome, what they feel is the functional. And we have to make those seamless, because you can have a beautiful aesthetic result, but if function isn't corrected, those veneers won't last 6 months and the patients will come back with chipped veneers. So there has to be an element of both.
Can everyone have veneers?
Everyone can have veneers, but they're not for everyone. Just because you can have a veneer, it doesn't necessarily mean you should. And we have those discussions with patients. Once people understand the process and we walk them through what needs to be done, the longevity, the lifespan, the decision is the patient's at the end.